Maintaining optimal health as a diabetic involves more than just managing blood sugar levels. Essential nutrients play a key role in supporting overall wellness. Discover how certain vitamins can enhance your energy, strengthen your immune system, and improve your body's ability to function at its best every day. Number 1. Vitamin D. Vitamin D is crucial for diabetics as it helps improve insulin sensitivity, glucose metabolism, and reduces inflammation. The recommended daily intake for most adults is 600 IU for those aged 18 to 70 and 800 IU for those over 70, but diabetics may benefit from 1,000 to 2,000 IU per day, especially if deficient. Vitamin D can be obtained through sunlight, food, or supplements. Fatty fish like salmon, fortified dairy, egg yolks, and UV-exposed mushrooms are good food sources, providing varying amounts of vitamin D per serving. If food intake isn't enough, supplements can help, with options ranging from 400 to 500 IU per soft gel to 2,000 IU per day for deficiency. Vitamin D is fat-soluble, so it's best absorbed when taken with meals containing fat. The safe upper limit is 4,000 IU daily to avoid toxicity. It's important to have your levels tested regularly, aiming for 20 to 50 nanograms per milliliter. Always consult a healthcare provider before starting supplementation to ensure optimal levels. Number 2. Vitamin B12. Vitamin B12 is crucial for diabetics, especially those on metformin, as it helps with nerve health, energy production, and red blood cell formation. Metformin can interfere with B12 absorption, leading to a deficiency. Diabetics may need higher doses, ranging from 500 micrograms to 1,000 micrograms daily, while the general recommended intake is 2.4 micrograms. Vitamin B12 is found in animal products such as beef, salmon, eggs, milk, and cheese. For vegetarians or vegans, fortified cereals, plant-based milks, and nutritional yeast are good sources. Supplements can be taken in tablets, capsules, lozenges, or sublingual forms, typically in doses of 500 micrograms to 1,000 micrograms daily, which are well above the daily requirement to ensure adequate absorption. Vitamin B12 injections are another option for those with severe deficiency or absorption issues. Regular testing of B12 levels is essential for diabetics to maintain healthy levels and avoid complications related to deficiency. Number 3. Vitamin C. Vitamin C is vital for diabetics because it supports immune function, aids in wound healing, and helps reduce oxidative stress. Diabetics are at higher risk for infections and complications like diabetic neuropathy and retinopathy, and vitamin C can help mitigate these risks by protecting blood vessels and reducing inflammation. High blood sugar levels can impair vitamin C absorption, leading to deficiency. The recommended daily intake is 90 milligrams for men and 75 milligrams for women, but diabetics may require 500 milligrams to 1,000 milligrams per day for optimal benefits. Vitamin C can be found in citrus fruits like oranges, strawberries, red bell peppers, broccoli, and kiwi. Diabetics should aim to consume at least 2 to 3 servings of these foods daily. For supplementation, 500 milligrams to 1,000 milligrams per day is typical, but the upper limit is 2,000 milligrams. It's best to consult a healthcare provider to determine the right dosage and prevent complications. Number 4. Vitamin A. Vitamin A is essential for diabetics because it plays a key role in vision, immune function, and skin health. It also helps maintain healthy mucous membranes, which are important for diabetics at risk of infections. Diabetics often have lower levels of vitamin A, possibly due to poor diet or impaired absorption caused by high blood sugar. The recommended daily intake of vitamin A is 900 micrograms for men and 700 micrograms for women, but diabetics may need higher amounts, especially if they have issues with vision or skin health. Vitamin A can be obtained from foods rich in beta-carotene, a precursor to vitamin A, like carrots, sweet potatoes, spinach, and kale. For example, one medium sweet potato provides 1,000 micrograms of vitamin A, and 1 cup of cooked spinach provides 2,000 micrograms. Supplements are available in 500 micrograms to 1,000 micrograms doses, and diabetics should consult a healthcare provider for appropriate supplementation levels. Number 5. Vitamin E. Vitamin E is crucial for diabetics because of its powerful antioxidant properties, which help protect cells from oxidative stress caused by high blood sugar. It also supports heart health, reduces the risk of nerve damage, and may improve insulin sensitivity. Diabetics often have lower levels of vitamin E due to oxidative stress and poor absorption. The recommended daily intake for adults is 15 milligrams, but higher doses of 200 milligrams to 400 milligrams may be beneficial for diabetics, especially those with nerve damage or high oxidative stress. Vitamin E is found in foods like almonds, sunflower seeds, spinach, and sweet potatoes. For example, 1 ounce of almonds provides 7.3 milligrams of vitamin E, while 1 cup of spinach offers about 3.7 milligrams. Supplements are available in 400 IU doses, typically taken once daily, but diabetics should consult a healthcare provider to avoid excessive intake, which could lead to bleeding risks. Number 6. Vitamin K. Vitamin K is important for diabetics as it plays a key role in blood clotting and bone health. It also helps regulate blood sugar by improving insulin sensitivity, which is crucial for managing diabetes. Diabetics may have lower levels of vitamin K due to poor diet or medications like blood thinners that can interfere with its absorption. The recommended daily intake of vitamin K is 90 micrograms for women and 120 micrograms for men. Diabetics may benefit from slightly higher doses, particularly if they are at risk for bone-related issues. Vitamin K is found in leafy greens like kale, spinach, and broccoli, as well as in fish, meat, and dairy products. For example, 1 cup of cooked kale provides 1,062 micrograms of vitamin K, which far exceeds the daily requirement. Supplements are available in 100 micrograms to 200 micrograms doses. Diabetics should consult a healthcare provider to ensure proper dosing without interfering with other medications. Number 7. Magnesium. Magnesium is essential for diabetics as it helps regulate blood sugar, supports nerve function, and promotes muscle health. It also reduces inflammation, which is common in diabetes. Many diabetics are deficient in magnesium, worsening insulin resistance. The recommended daily intake is 310 to 420 milligrams, but diabetics may need more for optimal benefits. Foods like spinach, almonds, avocado, and whole grains are excellent sources. For those needing supplements, magnesium citrate and magnesium glycinate are best for absorption and gut tolerance, while magnesium taurate may support heart health. A typical dosage ranges from 200 to 400 milligrams per day, depending on individual needs. Magnesium oxide, though common, is less absorbable. Consult a healthcare provider for the right dosage, as excess intake can cause side effects like diarrhea. Ensuring adequate magnesium levels can improve insulin sensitivity, nerve health, and inflammation control, enhancing overall well-being. Always seek medical guidance before supplementing. Including these essential vitamins in your daily routine can boost overall health and help manage blood sugar effectively. They support insulin sensitivity, immunity, nerve health, and reduce inflammation. Ensuring proper intake through food or supplements with medical guidance prevents deficiencies and keeps your body strong. Prioritize nutrition for better well-being. You might also want to watch this video for other crucial vitamins for diabetics. And please subscribe to this channel if you found this video helpful. Thank you for watching.